Thank you for joining us, everyone. I'm Ron Corning, happy to be your moderator here for the next 30 minutes as we bring you a special live Facebook event brought to you by FWD DFW, together with the Dallas Morning News. We are in the midst of a crisis, a community-based crisis, the likes of which we haven't really dealt with before. And our goal here is to delve a little deeper into a particular issue related to this coronavirus crisis that we're dealing with, also known as COVID-19. And particularly today, here's what we're talking about. Those who are most vulnerable in our community. Seniors. Seniors are most vulnerable to the disease. They are among those who are dying at a higher rate. And also they are among those who are, in many cases, isolated and shut in. We want to talk about Meals on Wheels. It is likely probably one of the most recognizable organizations, volunteer-based organizations that feeds shut-ins, and among them seniors. Also, social isolation. We've been talking about social distancing and isolating ourselves for the sake of not spreading the disease. But what does it mean for a senior when they can't get that care, that one-on-one personal care that's so important to their emotional health? We'll talk about that. And finally, a reality of life that so few of us want to talk about, and that is the final chapters of our life. There are some 600 patients in 14 counties in North Texas who are served by hospice. What happens if our healthcare system becomes overwhelmed by other cases? How will those families get the care they so need as they deal with, again, this last chapter of life? We have special guests here today who are joining us to take us through this step by step. Among them, we're joined by Catherine Kraus. She's the president and CEO of Visiting Nurse Association, VNA. Jennifer Atwood is with VNA as well. She's the managing director of development and communications. Gillian Breidenbach is with the Dallas Morning News. She is vice president of community and civic engagement. She's joined by Melissa Plaskoff, who is the president of On Air Media, where we are broadcasting from today. Thank you both for being here, and thank you, Gillian, for reaching out and beginning this effort to have this very important conversation. Catherine, I want to start with you because as we were preparing for this, I asked you, as an organization that depends on personal contact, people delivering meals to those who need them, people who are food insecure, had you ever prepared for the prospect of not being able to do your job?
As we talked before off air, is that VNA, because we receive government funding in different areas of our business, we prepare emergency preparedness as a group of quality professionals and doctors and such. And so we were prepared for something similar, but as we talked as well, it's mainly tornadoes that we prepare for.
You prepare for natural disasters
Right.
and weather events, and the idea of a pandemic
Right.
that would cause the sort of isolation and social distancing that we're talking about is not something that really we've prepared for, Jennifer. We've thought about it. We've heard about it. We've heard Bill Gates speak to it. There's an entire series on Netflix about it. And it seems as if almost overnight our world has changed. Are you feeling that?
Absolutely. We have been in crisis mode since this has been announced, trying to come up with all kinds of new and innovative ways in addition to our traditional means of serving our clients. How can we protect our clients, our patients, our staff, our volunteers? And it's just taken a village. We meet twice a day as a team to decide what we're going to do next, and so that we can act swiftly.
So I want to show some video here because we have video of your volunteers in action.
Okay.
They are out there and they are delivering, and they are, in many cases, hugging and touching their clients. And we're going to talk a little bit more about the importance of that and what that means, especially to seniors, some of whom don't have family members and have fewer friends the older they get, and so forth. And you call it social nutrition, and we'll address that coming up here as this conversation continues. So let's talk about the other part of this, and that is a food shortage. I was at the grocery store last night. The shelves were virtually bare. I mean, I'm buying things I would never buy before and wondering what I'm going to do with frozen chicken, apple sausage, and pureed pea soup. But that's what was there, and so that's what I bought. So you, too, are part of the food supply chain. You have some food stockpiled, I know, that is non-perishable, but it only lasts for a certain amount of time. What's the contingency plan for that?
First of all, we haven't seen a disruption in food supply chain. We get our supplies both locally and from an international organization that works out of Mississippi to deliver us food. So we have not seen that. We do not anticipate that.
Good.
Shelf stables, we have ordered those for clients. My main concern is making sure that when we deliver the meal, which we are still doing 100%, when we deliver the hot meal, that we maintain the distance between our clients that we're delivering to and our volunteers or paid
And how are you
drivers.
doing that? Are the volunteers going to the doorstep and ringing the bell or knocking and leaving the meal and walking away?
So not right now. It's been a rule for Meals on Wheels. It's a state mandated rule, and it's just best to not do that. We can't leave a hot meal on the doorstep because of food safety concerns.
Okay, so how do you maintain social distancing and get that meal to
Sure.
them?
So we started last week with really educating our volunteers and our staff about what this means. So we already had measures in place with volunteers to make sure that they understand safe food handling instructions. All of our meals are already prepackaged, and the cold portion of the meal is in a plastic bag. So we're already telling them that they need to wash their hands before. We've provided our volunteers with hand sanitizer to clean their hands before, during, and after delivery. And the hardest part that we've had to really instill is that social distancing, to say no more hugs. That's
Right.
been a big component of Meals on Wheels. That's one thing that we've had to really stress with our volunteers and our clients. And that's the one thing when you've asked them, what's been the change? It's that they miss the hugs. So
Yeah.
we're giving those air high fives at the door, air hugs, checking on them. So right now, we are handing that off. We'll see what happens, down the road.
I think going into this, as we came to terms with the fact that this could be a crisis of great proportion. We've seen it in Italy, we've seen it in other countries where that curve, as they say, it peaks so high that our health system is inundated with patients and our healthcare system is taxed as a result of that. We can flatten that curve with the steps we're taking now, and it appears as if cities everywhere are taking the steps. Small towns are taking the steps. I have family in Eastern Maine, and it's a small town, and yet they're canceling school and they're closing restaurants, et cetera. But we still have to factor in some of the unknowns and some of the uncertainties and some worst case scenarios. And I had said to you, if you get to the point where you're unable to fulfill the needs of people, and let's say restaurants have slowed so they could pitch in and help you in their kitchens, guidelines don't allow for that sort of thing. You are under the strictest of guidelines to use your own commercial kitchen.
Yeah.
Where do you then begin to kind of troubleshoot any problems that might arise?
So I think that right now, we, like Catherine said, we have the supplies on hand to prepare the hot meals for as long as we can. Another component I'd like to mention is that we do provide the meals for several congregate locations throughout the county, throughout Dallas County. Those
And
are
you also
senior
have some
centers.
non-perishable meals that you've
Yep.
you've
Right.
stockpiled
Yes.
those.
Right.
And as you said,
Absolutely.
perhaps not as appetizing,
Yeah,
but it still
it's food.
fulfills the need in a time of crisis. I
Right.
want to show people a graphic
Okay,
here because we want to show them, we want to show people who are at home right now what your shortfall looks like in terms of volunteers and what this means in terms of money. Because of guidelines, you're not able to donate food to Meals on Wheels, but you are able to donate money to help them buy and purchase the food they need. So Jason, let's show that graphic. So a meal is $6.50 a day. Meals on Wheels provides one meal for a senior per day, 5 days a week. That's $1,700 per year to feed a senior. There are 500 people on that waiting list. So if you do the math, there's the total need right now as we sit here today, 850,000. So if you're watching us in real time, live, and on Facebook, please share this post, share that information, do what you can monetarily. I know many of you now are also facing an economic crisis if you're in the restaurant industry and not working, but others of you are working and you're working from home. So you're still making an income. One less latte a day could feed a senior one meal. That really is the truth of it. Those of us who have need to think about how to give.
Right. We would appreciate it. And we do get lots of folks calling and emailing and messaging us on Facebook and asking how they can help. And that's really how they can help. Another way is to volunteer. We have to have our volunteers fully vetted before they can have that touch point with our seniors.
And that's a process that takes about a week?
Yeah.
Correct.
About a week. So
Correct.
you train them so that they are
Right, and
aware of standards
we have
and so forth.
online training. So all you do is go to vnatexas.org, click on the volunteer link, and then you can go through the process, get your background check, do online training with videos, and be prepared to go.
So there's that website. We're going to have more information on that in a moment. I want to go to Gillian Breidenbach from the Dallas Morning News because you've spent most of your career really tracking the power of philanthropy, corporate citizenship of companies in Dallas that give, individuals who give. We're a really good community when it comes to giving money. In terms of giving our time, are we just too taxed, or have we just not been conditioned to give of our time?
North Texas is very generous. Just take a look at North Texas Giving Day. We're really good, and we rank kind of number 2, 3, 4 every year in nationally giving dollars. We're really good at writing checks. What we need to get better at is volunteering, and I think we are at a time right now where we need to develop our volunteer army, and this is a great way to do it. You heard what Catherine and Jennifer said. It takes a week to get ready. We've got some time on our hands right now. Let's help these nonprofits. Let's get through this as North Texans do.
Yeah, I would say if you're among those people whose job for the moment is on pause, you may be unable for whatever reason to make up that difference economically. So you've got time on your hands, and you may find that there's some sense of reward and some riches in just giving of your time and helping a senior. We'll worry about balancing the checkbook later. I mean, I know this is going to have an economic impact on people. Personally, we've already seen that globally. We've seen a contraction in the economy. It's showing itself in the markets. I know people are worried about their retirement accounts and how long this will last. But the volunteer effort, are you prepared if people answer the call to train an onslaught of people who come your way?
We absolutely
with the systems
are.
you have.
So we were, this is great timing. About a year ago, we launched a new volunteer portal for our Meals on Wheels program and a mobile delivery app. It has been key, thanks to Leidy Hill, Toyota, Credera. Great.
Again, people who give.
Yes,
Right.
People
very
who give.
large institutional and personal donors who saw a vision for Meals on Wheels and how we could really mobilize a large army. We developed this portal, so as Catherine was saying, you can go to volunteer.vnatexas.org. You can begin that process. All the training is done online, and the background check is done. What we have talked about as part of our contingency plan is if we cannot deliver to the doorstep, the mobile app that we have created will allow us to do a virtual delivery. So as of right now, our volunteers have this app on our phone. Their daily route, their manifest, a list of the clients that they're going to deliver to, their address, their phone number is already in that at their hands on their smartphone. And so what we'll do is volunteers will be assigned that same route as if they were going to physically deliver the meal, but instead they would call each client. They can call directly from the app and check on them. We're going to
We have some footage. Can we show
Sure,
this?
absolutely,
Okay, Jason,
yeah.
will you roll that so we can see
And
how
it
this works?
really is such a simple gesture, isn't it, to be able to call a senior who is
Oh, absolutely. I would say get with your
Alone.
children
Yes, that would be amazing.
and give
Yeah.
that virtual hug.
because kids are out of school.
Yes,
And
they
so
are.
in this, there might be, and I think this is the upside when we talk about as a community, as a country. Listen, we've seen people fighting over toilet paper. We need to be a little more civil, right? I mean, come on. After 9/11, we came together as a community, and sometimes I fear our memories are a little too short and we forget how we feel in those moments of crisis when we really need each other. So we've come around again, a different crisis, a different time, but the same sense of uncertainty and fear that hopefully will bring the community together in meaningful ways. I saw somebody post, maybe it's time to pick up the phone. We don't talk a lot anymore. We text. Maybe we need to talk a little more on the phone when we're isolated and we're trying to protect ourselves and protect others around us.
And I think you bring up a great point. This is a great time to teach our children about communication and how to connect with someone else over the phone, use their words, and send loving thoughts and words. And this virtual hug is, I can't get it out of my head. I want to do that with my children because they are home and getting them off of their iPads and devices. But this is a way for them to connect when we are being asked to disconnect.
Okay, what are people saying on Facebook? Because I know you're our Facebook guru over there and you're monitoring all the comments.
Okay, so we have a question about where to donate funds.
Okay.
Exactly what is the link?
So if you'll go to VNATexas.org, that's TEXAS spelled out, /give, or you can just go directly to the website. There's a give button at the top. Lots of options to give there, make a tribute gift. Easy to do.
I have to say, I've checked out your site. I had checked it out before, especially on North Texas Giving Day, but you've made it really easy for people to, A, understand what you do, see the impact with the videos you have there of what you do, and give so you can continue to do what you do, and especially right now in a time of crisis. As we talk about volunteerism and how to do it, we want to take a little bit of a break just to remind you how you can get involved, how you can become a volunteer to help Meals on Wheels. Our conversation continuing with the folks from VNA, the Dallas Morning News as well, when we come back in just a moment. Volunteer, make a positive impact, move forward together. Volunteering connects you with the community to serve and impact others for the good. Want to help but don't know where to start? We have your connection to make a difference. Go to FWD DFW.com/volunteer. And on all social media, use the hashtag #WhatMovesYou. We are back here with you and doing a deep dive on an issue that is so important as we weather this coronavirus crisis. It really is a community crisis that affects all of us in so many ways. And in fact, I think we're bombarded with so much information on how it's impacting us. First, there's the health impact, the steps we need to take to protect ourselves and protect others. How long will it last? It's the uncertainty. Someone said yesterday, as the markets were dropping once again, he said, I would rather deal with bad news than uncertainty. So to know is better than to not to know, even if the news isn't good. And what we don't know about this is what creates fear and anxiety, and therefore lends itself to some of the less civil social behaviors we've seen. So we're trying to get a handle on how to help those who are most vulnerable, our seniors. We know that older people are more susceptible to the disease. They're more susceptible to death because of it, as opposed to younger people. And we know that it can spread very easily and very quickly. We're trying to practice the 6-foot social distancing. Admittedly, we're not exactly 6 feet apart, but we have taken a lot of steps here in this studio to make sure that it is sanitized. And I have to say, I reflexively just reached out to shake your hand, and Catherine said, really? Really? I thought I'm just being kind. I'm shaking your hand. I mean, I was like, all of a sudden, I'm like going to prison. I was convicted of a crime. I mean, really. So I was like, okay, sorry. So yeah, we have to change some of our habits, and it's not easy to do. We've touched on this, and I want to just go a little deeper into this, because I love how you frame this issue of social isolation. You provide food nutrition with Meals on Wheels to people who are food insecure, meaning they may not be going hungry, but they don't have enough. And there are more food insecure people in this country than I think we want to admit. But you talk about social nutrition.
Right.
We're denying ourselves social nutrition as we isolate, and seniors aren't as connected as the rest of us. They're not on smartphones and apps, and they still have a hard line. We need their phone numbers. We need to talk to them. We need to place a phone call. Those are the sorts of things you're encouraging.
Right.
Yeah, absolutely. We know that before this crisis, that social isolation is a chronic condition in America. And when you talk about the social determinants of health, it's what happens in the home outside of the hospital walls. And that's really what impacts someone's health more than anything.
Because it can lend itself to depression.
Absolutely.
And depression, as we know, the science bears it out, can also exacerbate physical health conditions.
And by nature of qualifying for Meals on Wheels, you have to be homebound to receive charitable donations. So usually the Meals on Wheels driver is the only person they see that day, and they dress up to see you. They get dressed. It's a reason to come to the door.
No, we saw that with that imagery, and we're happy to play it again, Jason. If you're just joining us here for this live event, we've been talking about the importance of making sure as we weather the coronavirus crisis that seniors who are most susceptible to the disease, but also some who are homebound and rely on Meals on Wheels to be fed, look at this kind of personal attention and touch. That's the kind of thing that we're not allowed to do under these circumstances. And so the folks from VNA are trying to guide us around how to do that, but also to meet that need, $850,000. And I don't mean for this to sound like a telethon, but really in a way, this is information meets telethon. We're trying to inform you of a need so you'll feel inspired to give so they can meet their need of $850,000. They feed seniors one meal a day, 5 days a week at a cost of $6.50. And I heard that number yesterday and I thought, to think of what I spend when I go out for dinner, I could skip a meal and feed a number of seniors. And so we all need to begin to think that way as we do our own grocery shopping. What can we do without for the sake of $6.50 to feed a senior for a day?
That's absolutely right. And we know that the need is only going to grow over the coming weeks and months. Catherine and I were on a phone call today with a bunch of our colleagues in the social service world, and all of the needs, it's almost overwhelming. But what we should be really proud of as North Texans is how we are coming together to address the needs of the most vulnerable in our community. And we're going to rely on each other. We're going to be referring services. Catholic Charities was asking if they could refer folks to us. We want to say, yes, we can. We have the capacity in our kitchen to feed 12,000. We just can only do it with the funds.
And you know what else I think is happening here, Catherine, is we're bridging a gap between generations, because the World Health Organization, the CDC, and others have said millennials are the ones who can help us through this crisis.
Correct.
Unfortunately, some feel that they're impervious to this because it only affects older people, as we've been told. But younger people can be asymptomatic, not show symptoms, and be carriers.
Right.
Younger people have parents who have parents. So we all have grandparents. They could be susceptible to this. But millennials also are in a situation where they're so connected socially on social media, they can spread the word. What we're doing today, millennials can share and spread more than anyone, right? And hopefully
Correct. And
help support your cause.
And we have, as Jennifer mentioned, we have more volunteers coming forward that are millennials. And
It's
helping
encouraging,
us.
yes?
But we all have to remember and take very serious universal precautions, not just the distancing when you're delivering the meal, but also the hand washing, sanitizing. Just because you're probably not going to get the disease, you can be, as you said, an asymptomatic carrier. That means you're not showing symptoms, which is the cough, which is the congestion,
Right.
or the temperature, but you still could be a carrier and putting your elderly at risk. So utilize universal precautions.
We also talked yesterday, as we were preparing for this notion of being trained to be a volunteer, even if you're not needed, because you may be needed in the future. It's almost like being a National Guardsman or woman. You train, you know what to do if needed, you're on standby, and you're called in a moment of crisis. And so that would be, I would think, best case scenario for you, is that more volunteers than you even need are trained and ready to go. So if in the future we're faced with a crisis, they're there to help.
Correct.
Also, I just wanted to add to that. We talked about this yesterday as we were planning to extend this. It's incredible what you're doing, and people are saying here on Facebook that it's the most rewarding experience to volunteer, but also helping your neighbor. If you have an elderly neighbor and you're ordering food, why not order for two and just even leaving it on their porch? Because they may not be going through this, but I think it's opening the conversation and kind of collaborating between these generations and saying, how can we all kind of help our neighbor? These are people living in Dallas, and we should be opening our arms, whether it's through your program or our next door neighbor.
Yeah. We see this community come together all the time. This is a time we need to come together. We need to donate money, clearly. We also need to build our volunteer base.
And isn't that why Forward DFW was formed? I know that together about a year and a half ago, you joined forces with the Dallas Morning News, and it was part of an effort to reach people for community-based organizations so that they can have the support and the help that they need. Because this is a city in an area of great abundance in so many ways, and yet in other ways, it's easy to overlook that there are those who need our help.
Clearly, we've got companies that are incredibly generous, individuals, foundations. FWD DFW is a way to really connect the corporations, the company, and the causes together and encourage people to go do something. Do we want them to go just have civic engagement, whether it's donating, volunteering, voting? How do we get our companies, what they're doing, and our community mobilized to go out and really make North Texas the best place that we know it is?
And we never imagined we'd have this cause, that this would be the cause that would bring us together. Exactly. And the Dallas Morning News has taken extraordinary steps as well to make sure that you are informed of what's happening every single day. This is a story that's evolving and changing really hour by hour as more test kits are given out around the country, as we learn more about where this is hitting, as we learn more about the health effects of it, as medical institutions search for a treatment, a vaccine. Should this be a seasonal thing that circles back again? We simply don't know. And so we want to give you more information on that and thank the folks at Baylor, Scott, and White Health who are also part of today's special live event. And we'll be back in just a moment. Thanks to FWD DFW and Baylor, Scott, and White Health, the Dallas Morning News is providing public health coverage of coronavirus free of charge. Go to dallasnews.com. So I talked about this at the top of the broadcast, and that is an issue that so many of us don't really want to talk about. I think it's something that needs to be talked about more openly, and that is the final stages of our lives. It's the one thing we all share in common. We don't talk about death. We don't talk about dying. We don't talk about the stages of it. But I can tell you that the folks at Hospice certainly know how to take a family through it. I've been there myself with my own mom, unfortunately, too recently. And so I understand the importance of the emotional support that hospice volunteers, hospice caretakers provide. VNA is also part of that operation and organization. And by the numbers, 600 patients in 14 counties in North Texas at any given time. So that 600 families are dealing with a loved one who is at home in many cases, because that's where they've chosen to spend their last days. What are your concerns about this virus? It could increase the death toll. As we know, there is a death toll attached to it. A certain percentage of people, exponentially higher than the flu, can die from this if they are infected. And that means that your hospice operation could also be stressed and taxed. How are you handling that, Catherine?
That's a great question, and certainly in emergency preparedness, we worked on this. But what we're doing right now, we are staggering staff at the office to limit the administrative staff, because there's always intake, there's always a lot of things that happen at the office, so we've staggered staff there. We clinically screen the patients as well as our staff before going in the home. We are in constant contact with the patient as well. Most times the patient is in the home, but many times they're also in assisted living or nursing homes, and we've been limited on staff to not us, but we cannot send our chaplains or social workers in. It's just essential staff that go in, nurses and the
Well, we
aides.
need to look no further than Seattle to know that the largest number of deaths among the death toll
Right.
clustered was in that one nursing home.
Right.
Because it was sort of ground zero, one of the first places where the virus hit. By the time they realized what they were up against, it was simply too late. We've seen in Italy, by the time they realized what they were up against and took precautions, for lack of a better analogy, it's like closing the barn door after the horse has left, right? They were then left with a healthcare system that was stressed out, ICU beds in hallways and so forth. So if our healthcare system as a whole, if we don't flatten that curve and we don't keep people out of the hospital, the people who would care for the terminally ill at home are being called into the most triage crisis situations at hospitals.
Correct.
And then they also are at risk of getting sick and being overworked.
Right. So again, what we've done, we're universal precautions and doing everything we can to limit exposure. People have been fitted for masks, appropriately. So fortunately, things are going well now in terms
They are.
of visiting our patients. But it is important to know that President Trump also made a point that end-of-life staff are important to go in, but just from personal experience, we found out this morning, my mother's in assisted living, her home health aides can't go in. And I support that policy, but I think for your end-of-life staff, it's important that they are allowed in because they know how to manage symptoms.
Right. Caregivers, when I talk about caregivers, family caregivers, members of a family who are taking care of their loved ones, I know are often instructed by hospice on how to do that, and then hospice is called during those moments when they're most needed, when they come up against something that they can't handle. I think we're all inclined, when it comes to caring for our own family, to feel like we can go it alone. So I want you to offer advice to family caregivers about what to do in terms of reaching out to you when they don't recognize that they need help.
You mean pre-hospice?
Pre-hospice, or they're getting to the point where they haven't quite come to terms with the fact that they need your help, and so they tax themselves beyond their own limits.
Right, and that's the hospice for VNA is the oldest one in Texas. And so again, we have a lot of experience in this. We also have a Medicare certified palliative care program, and that is pre-hospice. And so if you believe that you're at that point where you need support, we can do a consultation with your family member. And again, it's your choice. So we're there to help.
Yeah. Caregivers, family caregivers take on a lot.
They do, and that is an important component of care in the home. It's a holistic approach, and family members are key in supporting them as part of the hospice philosophy. Part of the hospice team includes a volunteer, includes a chaplain and a social worker, and those folks provide a lot of support for the family caregivers. Right now, our volunteers who are hospice trained are doing that over the phone. And so that's going to be key. And that's another area where we're going to see a lot of need. It does take a lot of training, but if we can start building that army of hospice and palliative volunteers, that would be great. You can also sign up for that on our website and making those calls and checking in just to say, how you doing? Is there anything we can do to help? We're here to just listen, and because we know that you're tired and you need the help.
I want to leave this on an optimistic note, and I think that is we're doing all the right things to this point, and being that you're in the center of this, and that you're part of the healthcare system, right? And you're being advised by, and you're keeping in touch with those who know more than we do about the track this is taking. Would you say, in an optimistic fashion, that we're on the right track?
Absolutely. I mean, no one's ever experienced this in our lifetime before, but I believe we're prepared, and our nurses and clinicians and volunteers have been educated to manage through this crisis.
But it's also raised a red flag that we always need people, and you just mentioned it, on standby, trained and ready for volunteers. Again, like the National Guard, they're there when needed, and perhaps this is a call to action to do that. So if we're faced with another community crisis, we're not in a situation where we feel like we don't have what we need to move forward in a worst case scenario.
That's absolutely right. And I have been just so overjoyed with the ingenuity of our own staff, that they are a caring group of people, and how we are visiting at least twice a day about what is the most innovative way we can care for folks. How can we make sure that our staff are taken care of? Because we really have to be careful about our frontline workers. We have a lot of nurses that are going out into the home all throughout North Texas, and we need to make sure that they're okay, their families are okay. Our staff and our leadership, our
They're giving of
board,
themselves and putting their lives at
absolutely.
risk in some way. It's a risk they know they're taking.
God
and-
bless healthcare across the board.
Really, yeah.
Across the board,
I think that's a
absolutely.
point we can't make enough. And it is true that we've seen that this has been a very difficult process to this point. A lot of people are being inconvenienced, and then there's the real economic impact of it. But Gillian, your efforts, along with the Dallas Morning News, Melissa, you allowing this to happen today, hopefully to speak to an audience about this important issue, I think is a positive in the community.
I hope so. I mean, in these moments, I think that's all you can do is kind of get together and see how we can work together and do something that's right, because that's all we really have right now. If not, it's going to go or your mind can go the other way. So I think if we can all kind of try to stay positive and call someone and lend a beautiful thought, I think as you notice, it will in turn brighten your own day.
All right. Thank you, Melissa. Thank you, Gillian. Thank you, Catherine Kraus, VNA President and CEO, Jennifer Atwood from VNA as well. Thank you for being here. Thank you all for joining us. And we want to remind you that you can get more information by going to FWDDFW.com. You can connect with companies, issues that are important in our community in North Texas. And remember, dallasnews.com for all the information you need about the coronavirus, COVID-19, as we face uncertainty, but take it step by step. Thanks for joining us, everyone. I'm Ron Corning. We'll see you next time.